IV nutrient therapy can be chosen instead of oral supplements for about 5 good reasons.
Oh, okay.
Number 1, better absorption. Okay. So IV nutrient therapy goes directly into the bloodstream, bypassing the digestive system, right? So, normally when you take your supplements, like I took my supplements this morning, they get dissolved, they go down, make their way through the intestines and get absorbed. Well, everything that gets absorbed through the intestines doesn't go directly into the bloodstream.
Yes, you're right. And sometimes it doesn't even get absorbed, right?
Right.
And sometimes it's just broken down too quickly and not absorbed at the right place.
Yes.
So you're taking a chance.
Yes. And some things you might be eating with the supplements might be inhibiting that absorption. So various reasons
And
for
sometimes you need to eat something to help enhance the
Exactly.
absorption.
Oh,
Exactly.
okay.
Right. So there's something called the first pass effect, where when you that's where substances get partially broken down and metabolized by the liver and other tissues, and only a small fraction of what you originally took ends up in the bloodstream. There's a venous system that goes directly from the intestines to the liver, and that's what the liver decides how much to actually put out into the blood. And so you have to account for that when you take an oral substance. If you have an intended level to be in the blood, you have to raise your dose to make sure you get that amount. And that means more pills, right? But with IV nutrient therapy, 100% bioavailability goes right in there. So that's better. Number 2.
So what you're getting is going to go where it's supposed to go.
That's right. That's right. It's
Regardless of
gets
what you
used.
ate.
All of it gets used right away.
Yes.
Number 2 is faster effects.
Yeah.
Right. So since nutrients go directly into the circulation, people often feel the effect faster, sometimes minutes to hours. Right. And especially useful for things like energy, hydration, immune support. And that highlights a lot of reasons why people come to get IV therapy in the first place.
Right.
Right. So maybe they're taking a flight like you.
Well, yeah. No. I'm a strong believer. Absolutely right. I got COVID when I was traveling. And then when I came back, the first thing I did was get my IV. And then ever since that, every time I go on a plane, I get my IV treatment before I fly. The other thing is that the nutrients are bioavailable very quickly. And when people fly to Vegas and you see all these pop-up places and they come to your hotel rooms to give you
They can
IV.
do that right there. Delivery.
Yeah, exactly.
Yes. Dehydration is another big reason.
And people don't even think about it. And as we get older, we have a tendency to drink less water because our thirst receptors, our thirst centers are compromised. And so we confuse hunger and thirst and we keep eating more, sometimes without drinking water. And I had a patient yesterday who tells me if he doesn't think about water, he doesn't drink water all day long.
I always get dehydrated on an airplane.
Yeah, while traveling, absolutely
Yes.
right. And now summer's around the corner, and so it is not uncommon. It is actually quite common. And so this gets you the fluids that you need right away.
Or maybe you have a bout of food poisoning or just a cold. I had a patient get an IV infusion before their pickleball tournament. So there's lots of reasons why you might do that. Number 3, higher doses, right? So you can't get everything orally at the dose that you might want. Vitamin C, for example, the body can't absorb a high dose of vitamin C through the gut. It causes diarrhea, which we don't want, right?
So if you're on high doses vitamin C and you start getting diarrhea, please cut back on your dose. You're just taking too much.
But with IV infusion, it goes straight from the blood right into the tissues. You can avoid those side effects, right? Number 4, custom formulations, right? So IV drips can be tailored to your exact needs, whether it's fatigue, immune system boosting, skin health, recovery from illness or workouts. And we currently have 5 different ingredients to choose from, right? So we help you, you can mix and match 2 or 3 or 4 or all 5 of them.
And it's we're joking about it, but seriously, if you're not sure what you need, that's why Dr. Pentland can actually help you with that. Now,
That's
some
right.
people that get them routinely do have an idea of what they want, and they can definitely come and say, hey, this is what I got last time. It really worked for me. Go ahead and give me the same thing again. But if you are not sure, but you have something that you're looking for, either it's more energy or that you're getting ready to fly, or that you feel like you're getting sick, allergy season is coming upon you, then basically just tell Dr. Pentland what's happening, and he will then help you make the choice.
We just revised our menu, so the combinations sort of highlighting the different purposes that you might pick from. We have 5 different ingredients, like I said. So NAD helps with brain function and cellular energy.
Yeah,
Taurine.
so cognition is huge.
Cognition is
Remember,
huge.
the mitochondria, you must have heard all of us say this many times. The mitochondria is the powerhouse of every cell. But the mitochondria gets its energy from NAD. And so as we all get older, our ability to make NAD is decreasing. And there's no pill that you can eat to make NAD. So there is NMN that you can take orally, but it's not as efficient and as effective as an IV. So if cellular energy, cognitive function is what you're looking for, then NAD is what you need. And a lot of people using it have told me that their exercise capacity improves.
Yep.
They feel warmer. They can actually work out without being tired. I think Ben's had asked earlier this morning about fatigue, and I wanted to say this, but the gentleman he's talking about is 94 going on to 95. So you have to be careful about age as well. But if you're younger and you're feeling like you just don't have that energy level anymore, then come and give us a call and we will help you with the choices.
And one thing that a lot of people do with NAD is taurine, which helps with cognitive function as well. Helps with heart, liver, kidney function, and stamina.
Cellular energy again.
Cellular energy. So, and then there's also vitamin C, which, normally you take 500 to 1,000 milligrams per day orally. You come in for an IV, you can get up to 10 milligrams through us within an hour visit. If you get a super high dose, that takes longer because it's a bigger bag. But vitamin C helps with connective tissue, helps with antioxidant support, helps with integrity of the skin and organ systems.
Beautiful, my
Beautiful
lady.
skin.
Yes. Let's do a close-up on Dr. Ummat's skin.
Beautiful.
And it helps the immune system by supporting white blood cell production. Then there's glutathione, which is the master antioxidant of the body. Getting a boost of that can reduce oxidative stress and also brightens the skin. So sometimes we'll do vitamin C glutathione combination, which is very nice. And then there's the Myers cocktail, which is
my favorite.
it's her favorite. It has a bunch of B vitamins, calcium, magnesium, and there's also a little vitamin C in there too. So we have a lot of sort of options and pieces to mix and match for that.
Okay, and Dr. Pentland, if we don't know which one is best for us, we just discuss it with you, right? Say,
That's
okay,
right.
this is what I'm needing, and you'll know.
We make it easier because we have package deals. So you get a package of 3, there's a 5% discount. Package of 6, there's a 15% discount. And you can mix and match. We just revised our menu, which combo you want. You can look at it and say, I want one of these, one of these, one of these. You lay out your program for the year, and we'll help you with that.
And about how often do you choose to do an IV therapy, or does it depend on the person?
People often ask me, how often should I get an IV therapy session? And it depends on your condition. Of course, if you have like a cardiovascular condition or memory lapses, you might want to do more frequently. And one of those package deals might be a good thing in that case. But often I'll say, how often do you want to take a vacation? It's the same idea because IVs improve the environment of the cell, right? It's putting good things around the cell. So it's like changing your environment from a crowded freeway to a white sand beach with clear blue water, right?
Yes.
My idea of
I'm
taking
there.
a vacation and my bosses are very different, okay?
Okay, that is wonderful, Dr. Pentland. Thank you for that. If you have questions about IV therapy, give us a
Nicely
call.
done, Dr. Pentland. But I'm a firm believer. Absolutely love our IV therapy
Yes.
program.